Welcome to the deep dive. Today, we're really zeroing in on basal cell tumors in our cats and dogs.
That's right.
Think of this as, well, a quick guide to understanding this pre-common skin thing. What are they? Why should you care?
Exactly. We're trying to cut through some of the medical speak. Essentially, these are growths. They start in the skin.
Okay.
But what's interesting is they're not all the same. You've got let's say, the less worrying kind,
Yeah.
and then the malignant type. It's less common, but still important.
Okay, less worrying versus malignant. What's the key difference for us as pet owners? Like, what really matters day to day?
Yeah, the thing you really want to know about is spread, metastasis,
Right.
the benign ones. Very, very rarely spread. Almost never. And even a malignant one, the basal cell carcinoma, it's actually uncommon for it to spread.
Oh, really?
Yeah. So that's, often a big relief for people.
That is good to hear. So how often do these actually, pop up? Are we talking rare, or is this something vets see a lot?
Oh, it's surprisingly common, especially in cats. I mean, it's the most frequent skin tumor diagnosed in cats.
Wow, the most frequent.
Yeah, showing up in like 15 to 26% of feline skin tumors. Dogs get them quite a bit too, maybe the second or third most common. So, yeah, definitely not rare.
Okay, so definitely something to be aware of. And is there a particular age we should be more watchful?
Generally, yes. For dogs, it's typically middle-aged to older, think maybe 6 to 9 years old.
Okay,
Cats tend to skew a little older when these appear, often around 10, maybe 11 years or even older. So it's often something that comes with age.
makes sense. What about breeds? Any
Mhm.
particular dogs or cats more likely to get these? People always want to know about their specific breed.
Sure. Yeah, there seem to be some predispositions. In dogs, Cocker Spaniels, Poodles, those breeds seem to pop up more often in the data.
Hmm.
And for cats, Siamese breeds are mentioned more frequently. So if you have one of those, it's maybe something to keep, in the back of your mind. Not to worry, but be aware.
Good to know. All right, let's talk signs. What are the red flags? What should you be looking for on your pet's skin?
The classic presentation is usually a single lump. It feels firm. Often it's lost its hair, and it's kind of raised from the skin surface.
Okay.
You'll often find them on the head, the neck, or maybe the shoulders. Size-wise, they can vary a lot. Tiny, like a
Yeah.
few millimeters, or much bigger, several centimeters.
And anything specific for cats? You said they're really common in cats. Do they look different?
Yes, good point. In cats, they're often quite dark, heavily pigmented,
Mm-hmm.
so they might look black or really deep brown.
Oh, okay.
And sometimes they can be cystic, like fluid-filled, or even ulcerated, meaning the surface is broken or scabbed.
Interesting. So what actually causes them? I mean, in people, we always hear sun exposure, sun exposure. Is that the deal with pets too?
That's one of the really fascinating things here. Unlike in humans, chronic UV exposure, sun damage over time, doesn't seem to be a major driver for these tumors in dogs and cats.
Huh. That's really counterintuitive.
It is, isn't it? Breed is a known risk factor, as we mentioned. And there's some suggestion, particularly in dogs, maybe a link to canine papillomavirus.
Mm.
But the sun thing, not so much.
Wow. Okay, so if you find a suspicious bump, and it might be this, what else could it be? What are vets thinking about?
Well, there's a whole list of possibilities, right?
Yeah.
That's called a differential diagnosis. It could be other skin tumors like mast cell tumors, melanomas, even things like histiocytomas or simple skin cysts.
Right.
Especially with those dark ones in cats. Melanoma is definitely something we need to rule out carefully. It just shows why you can't just guess you need a proper diagnosis.
Absolutely. So how do vets actually confirm it is a basal cell tumor? What's the diagnostic process look like?
Often the first step might be a fine needle aspirate, or FNA. They use a tiny needle to suck out a few cells and look at them under the microscope.
Okay.
That can give clues. You might see these sort of round basaloid cells. But for a definitive diagnosis, you really need histopathology.
Which means taking a tissue sample.
Exactly. A biopsy, or often they'll just remove the whole thing and send that off. The pathologist looks at the structure. Sometimes, especially for those pigmented ones, they might use special stains, immunohistochemistry, to be sure it's not melanoma.
And checking for spread. You said it's uncommon, but do they check?
If the tumor looks aggressive, or if the nearby lymph nodes feel enlarged, then yes, they might aspirate the lymph node too, just to be safe.
Yeah.
But it's not routine for every single case.
Gotcha. And under the microscope, what are they actually seeing with these tumors?
Oh, they have varied looks, different patterns. Pathologists describe them as solid, cystic, sometimes ribbon-like or adenoid. And you often see melanin, that pigment, especially in the cat ones.
Okay.
Interestingly, in feline basal cell carcinomas, the malignant type, looking closely at the cell nuclei, certain features there might help predict if it's more likely to recur after surgery.
Right, that makes sense. So, okay, you've got the diagnosis. What's the typical treatment? What's the game plan?
For most of these, especially the benign ones, surgical excision is the way to go.
Just cut it out.
Yep. Cut it out with clean cartons, meaning getting a little bit of normal tissue around it. And if they can achieve that, it's generally curative.
Curative. Okay.
For some smaller, more superficial lesions, other options might be considered. Things like cryosurgery, freezing it off, or a specific type of superficial radiation called strontium-90 plesiotherapy. But surgery is the mainstay.
And the prognosis, the overall outlook after treatment. What can people generally expect?
Generally, it's excellent. Truly excellent with complete surgical removal.
That's great.
Because most of these tumors are localized, they don't tend to metastasize. Long-term follow-up often isn't even necessary. Get it removed cleanly, and you're usually good to go.
Fantastic. Okay, so let's wrap this up. What's the big picture here, the main takeaway for listeners?
I think the key points are, these are common, especially in cats. But the good news is they're often benign, and surgery is usually very effective.
So finding any new lump or bump early and getting it checked is crucial. Don't wait.
Absolutely. Early detection makes treatment simpler and more successful.
And that fascinating point about UV light, worth repeating, that unlike us, the sun doesn't seem to be the big bad guy for these particular tumors in pets.
Exactly right. It's a really key distinction from human skin cancer.
So final thought then. Given how common these are and how they can look different ways, pigmented, cystic, just a plain lump. It makes you think, doesn't it? What other, maybe seemingly minor changes in your pet's skin might actually be worth a closer look, worth that conversation with your veterinarian? It kind of highlights the importance of just being observant, you know?
That's a great point. Better safe than sorry is always the best approach with our companions' health.